This is the Matrix, Lisfranc, and Midfoot fusion system. It includes 2-hole plates that come in 2 sizes, a small and a large, as well as a 4-hole curved fusion plate. You also have the option of a 6-hole flat fusion plate. Any of these can be used depending on the Midfoot Lisfranc variant injury that you have, or depending on the Midfoot fusions that you will need to perform. There are a variety of features of these implants that are important to note. First, for the 2-hole plates, you have a locking and non-locking hole on one side and an oblong hole on the second side. Depending on the position of where you place the screw in the oblong hole, you will get compression at the fusion or fracture site, or you will not. Furthermore, there is a window in the middle of these implants that allows for the surgeon to track the fusion site over time radiographically. On the 4-hole plate, we have the proximal locking screws that will accept locking and non-locking screws, as well as oblong holes over the metatarsals that are used in a compression or a static position. We also have a window in the 4-hole plate that allows for the surgeon to view the reduction and or the fusion radiographically. Finally, the 6-hole plate is very similar to the 4-hole, except that it is a flat plate that has 2 additional metatarsal holes which allow for additional fixation in the metatarsal. As with the calcaneus plates and all the matrix plates, you have towers that can be used to lock on to the plate itself, or you can do a quick connect locking feature where this locking tower sits into the plate using the 3 ears that are on the locking tower itself. You line these up, hold this tower flush against the plate, and it allows for a locking screw to be applied. When performing a ORIF of a Lisfranc ligament complex or even a midfoot fusion, it is important to draw out the anatomy so that you can plan your surgical approach. Remember, the first metatarsal is more distal than the second metatarsal, which is the keystone of the midfoot. And the third metatarsal is distal as well. By drawing out the anatomy under fluoroscopic guidance, you can decide, depending on the injuries that you have or the fusions that you need to perform, whether or not you will put a single extensile incision in the first web space or put a incision over the second web space proximally and one over the medial column medially. A variety of incisions can be used depending on the injury pattern. For the purposes of our video, we will be using an extensile first web space approach. Our incision will go right down the proximal aspect of the first web space in the intercuneiform area and right over the Lisfranc complex. Using a 15 blade, you will carefully dissect through this area. Remember, the neurovascular bundle, including the deep perineal nerve and artery, are in this area. pause it. Actually, you can show it. I'm just going to, because you'll have to edit it. Because I'm going to struggle here. Once you incise through the skin, you will elevate subperiosteally either with tenotomy scissors or carefully with a knife, going all the way down to the subcutaneous tissues, all the way to the bone. You will ensure that the neurovascular bundle is not in your way. When approaching the second tarsal metatarsal joint in the Lisfranc area, again, you will need to mobilize the soft tissues and dissect subperiosteally, both medially as well as laterally. Once this is performed, you will evaluate the second tarsal metatarsal joint, the first tarsal metatarsal joint, and the intercuneiform joints for any instability. If there is instability in any of these joints, they must be addressed appropriately. Your options for surgical fixation of a Lisfranc are a screw-only technique, which goes through the articular surface with one screw going through the area of the Lisfranc ligament, and additional screws going through the first tarsal metatarsal joint or second tarsal metatarsal joint, and even the intercuneiform joints as needed, depending on the injury pattern. Or you have the option of using the midfoot plates in order to perform a plating or bridging technique for fixing Lisfranc injuries. First, we will show you the screw-only technique. When approaching fixation options, you want to perform your reduction. We can use a pointed forceps or pointed reduction clamp to reduce our Lisfranc complex using one point on the lateral aspect of the second metatarsal and the medial point over the cuneiform. Once you like the reduction, you can hold the pointed forceps in the pointed clamp in position and check the x-rays to ensure that it is where you like the reduction. Next, you will first place the 4/0 cannulated screw across the Lisfranc complex area. You can do this either percutaneously or through the surgical wound itself. In this case, we will perform it through the wound. Place your screw guide wire for the 4/0 cannulated screw in the direction of the Lisfranc complex, going from the lateral aspect of the second metatarsal into the midpoint of the medial cuneiform. Once you like the placement of your guide wire, you can check it radiographically for position and then measure and drill for the 4/0 cannulated screw. We will drill just the lateral cortex only. And apply the appropriately measured 4/0 cannulated screw. At this point, you can remove the reduction forceps that's over the Lisfranc complex and evaluate your reduction. Again, depending on what other associated injuries you have, you may put a second 4/0 cannulated screw across the second TMT joint, one in the first TMT joint, or even into the intercuneiform joints. Alternatively, you can place bridge plates over the Lisfranc complex. Using the 2-hole plate or 4-hole plate, you have an option of placing screws into the cuneiforms and into the metatarsal at this point. We will show you using a 2-hole plate how to do this. You'll place the screw, the plate where you want it and hold it in position. Hold the plate where you would like it and drill the locking screw to its appropriate depth. You will measure the screw and place the appropriately length screw into the locking hole. Once the screw engages the plate, you will stop tightening the screw and go to the non-locking distal screw. Depending on whether you are doing a fusion or a Lisfranc ORIF, you will either put the screw in compression or put the screw in the proximal aspect of the hole so that you do not get compression. In this case, we are showing an ORF of a Lisfranc, so we will not be compressing the distal screw. Once you go through both cortices, you will measure your screw to the appropriate depth and put the appropriate measured screw into the distal screw hole. Again, in this case, we are showing you a ORF of a Lisfranc, so there is no compression being applied through this distal screw hole. If you are doing a fusion, you will place this distal screw in the most distal aspect of the oblique hole, allowing for compression across your fusion site. You want to have two finger tightness of these screws, and then you will go back to your locking screw and finish tightening your locking screw. You can apply a 2-hole plate in this manner on the second tarsal-metatarsal joint, the first tarsal-metatarsal joint, or even the third tarsal-metatarsal joint. If you have a Lisfranc variant and you want a construct that allows you to plate the first and second tarsal-metatarsal joints together, or you are fusing a joint that includes the second and third tarsal-metatarsal joints, you can use this 4-hole or even the 6-hole plate to do this all with one construct. Next, the guide wires are all removed. The wound is then closed with 2-0 vicryl sutures or 2-0 absorbable sutures and silks or staples for the skin.